Welcome to Love and Speak the Truth with me, Sister Brenda, the podcast where all voices are heard with diverse guests from all over the globe. We make space for stories of integrity, justice, freedom, and joy. So come along. We're not afraid to get into the tough stuff, and we're actually not afraid to laugh along the way. So buckle up, open your heart, open your mind, and let's get this party started. It is a great privilege to welcome Dr. Emily Pinto Taylor, MD, Assistant Professor in the Divisions of General Internal Medicine and Hospice and Palliative Medicine at Emory University School of Medicine in Atlanta, Georgia. A gifted teacher, mentor, and lifelong learner, she practices what she calls narrative medicine, leaning deeply into listening as an act of care. Through her work in palliative and end-of-life medicine, she accompanies patients and families with compassion and presence, navigating the delicate space between health, healing, and life's final chapters. So, Dr. Emily, how are you?
I'm good. I'm so
Yeah,
excited to be here. This feels so special.
it is special. Thank you so much for being here with us on Love and Speak the Truth. Hopefully, we'll have the kind of conversation that is so engaging like we've always had in our history together. So let's begin. Just tell our audience a little bit about yourself and your work, your specialty.
Yeah, sure. I identify as a Midwesterner, started from rural Pennsylvania. And I now live in Atlanta and practice medicine. I'm a doctor at Grady, which is Atlanta's public safety net academic hospital, which is a really interesting combination of
Mm.
adjectives. I am an internist and a pediatrician and went on to do more training in geriatrics as well as in palliative care. And my job now is kind of a mix. I'm a person who likes to do a lot of things. So I get to do outpatient palliative care and hospice, and then inpatient adult medicine with the
Mm.
residents.
Now, why hospice? I'm jumping ahead a little bit, but what drew you to be interested in hospice?
Um, you know, I get asked that a lot, and I have a couple answers. I think I knew for a long time that I really liked hospice. I really liked it as a medical student. I think what I liked about the type of medicine was that it was a chance to have conversations that really mattered. I always wanted to have conversations that really mattered. I look back on being a college kid and I spent 3 years shadowing in a HIV outpatient primary care practice.
Mhm.
And the patients that I remember from that practice were the people who were really struggling to take their pills. It was the people who had like complicated lives. It wasn't people who were sort of typical or had interesting medical illnesses. It was, like the man who um, stopped taking his pills because it made him lose his teeth. And he talked about not being able to go on dates because he couldn't laugh. He had to talk like this because he was missing so many teeth from his pills. And when that man got AIDS, I felt like I understood.
Mhm.
It wasn't what I wanted for him, but I felt like I understood
He
what
had to cover
happened.
his mouth.
And I
Yeah.
think, similarly, I think what is really fun for me about palliative care and hospice is that it's really about trying to understand people's goals and values in order to make a recommendation for what's right for them. And as
Mhm.
I was just teaching the residents this morning, one of the things I said to them is, oftentimes it isn't the thing that feels right to me. Sometimes it is, but oftentimes it's not. But it's a chance to like dig into somebody's value system and really try to understand them. And I
Mhm.
really love that. It feels like meaningful work every day. And it also feels like we get to cut the crap and talk about what really matters as opposed to stuff that people don't want to talk about, like their blood pressure or their diabetes or whatever. And I really enjoy that.
Is that narrative medicine that you're talking about? You mentioned to me that you are attracted to this thing called narrative medicine, and I have to admit I had not heard of it before. What is this narrative medicine you speak of?
Narrative medicine is, I think, sort of a made up term to sound fancy professionally. What it is people who are interested in thinking about patient stories telling their stories and hearing their stories and learning how that story impacts their life. I think in a lot of ways you are practicing narrative medicine.
Mm,
Narrative medicine is the hearing of somebody's story and allowing it to change you.
mhm,
I think that a lot of residents, a lot of medical students, they're exposed to these horrible things for the first time. And horrible's on a spectrum. Things that seem horrible to you may not seem horrible to me or may not be as horrible to me. I had a intern a couple months ago who, I could tell was really upset. And I took her in the hallway and was like, "What's going on?" And she started crying and was like, "We had to discharge this man to a homeless shelter yesterday, and I haven't been able to sleep." And I was like,
mhm,
"Discharge him to a homeless shelter?" That guy, I couldn't even remember. Like, that guy, he wanted to go to a shelter. He, declined referrals for resources and was like, "This is the one I wanna go to on this day." Like, that
mhm,
wasn't a hard discharge at all.
mhm,
And I was thinking like, geez, sometimes I have to discharge people who are like kicking and screaming and security has to escort them out. And this guy was like, please send me to this shelter. It really was upsetting for her. What I like about narrative medicine is it's an opportunity to teach residents how they can use writing and storytelling to help them process the stuff that they see, and help them figure out what's the meaning for that person, what's the meaning for me, and how do I move forward from it.
Tell me something about that resident. What do you think made her tearful and upset about the fact that this man, what was going on in her? Did you determine what was her story behind those tears?
Um, she had never been in a hospital like this. She had done training in a rural setting. That was where her med school was. And I think was familiar with a lot of rural poverty, which is very complex, but it's different. And I think she felt like she had never sent somebody to be outside when it was cold. And I think just that idea of like we sent him to a outside and he wants to have an apartment, but he doesn't have one was
Mhm,
really hard for her.
mhm,
I think it's always a balance of working with learners, like, it is okay for that to be hard for you. It should be hard. Like, when you stop caring about that, you stop being a person.
mhm.
And, like, a hospital is not set up to house people. And so how you work in a safety net setting when you know people are gonna need housing, but also are willing to say, "Our job is not to house you," right? Our job is to help you get to the next place. You have to be able to take some steps on your own. It's a really hard combination of things to hold at the same time.
What's it like to be involved, being a decision maker, being a caregiver, a physician, a professional in this climate right now where healthcare and serving the needs of disenfranchised people, people who are underserved generally. I'm sure you get a lot of that coming into this practice in Atlanta. I'm just wondering what's it like for you personally in your own life as you deal with the many needs in medicine, because it isn't just about treating illness or disease. It's a lot deeper than that. Maybe you have some insight.
That's such a complicated question. Yeah, you're 100% right. It is not just about treating illness. My program director, when I was a resident, used to say at the end of every clinic, the medicine is the easy part. And I think that's true. I think it's part of why I'm glad I like palliative care because I think all medicine is really like that. Like all medicine is really more complicated than just putting in a stent after a cardiac cath and walking away, right? There's so much
Mm,
more complexity to it. And I appreciate that. I appreciate that people are complicated. I think this is a unique time where it's really hard to even practice basic, straightforward medicine. I had a very easy, straightforward, quote unquote, boring clinic patient last week who is not dying, has some, symptoms related to a cancer that's getting better, and I've known her for a long time. She's a very straightforward, boring lady. And she told me that she hasn't been able to go to all of these orthopedic appointments because with the Medicaid cuts, Medicaid minimum or maximum amount the income that you could make went down in Georgia from 21 to 19,000. She makes 20,000 a year. She no longer qualifies for Medicaid. She had to buy insurance on the exchange. The stuff that she bought has a huge copay. It only covers a certain number of doctor's appointments a month. So now she's rationing. And here's a woman who survived a cancer, has multiple chronic illnesses, is trying to not become addicted to pain medicines and like is trying to follow up with all these people I want her to see to get her joint injections and the things that she needs. And
Mhm.
she's like, I can only do so many a month. Like I can only afford one. And she was walking me through her budget, like her itemized budget. I think feeling like she needed to justify to me, like, they charge me $150 and I get 861 from SSI, and this is how I spend it. And I was like, listen, like, none of that is yours to justify to me. Like, this is now the world that we live in, where when we don't have Medicaid expansion in this state, where we lose our subsidies for so many different insurances, like, we're seeing more and more people who are uninsured, and this is the place that they come.
But there's a real moral decision that has to be made when you're trying to help people restore their physical health, their emotional health, dealing with the financial obligations of care, to be alive, to be a human person. What does that do to the physician in you? How does that affect you in your life as you try to make sense of what is right, what is good? It isn't something that you come to terms with easily, I'm sure.
So the first thing that's coming to mind is that when we talk with patients and we try to help solve their problems, so I think there's lots of spectrums of how people respond to suffering, right? There is the choice to say
Mhm,
that suffering is not something I'm going to engage with. Like I'm going to do my thing and sort of allow that somebody else is going to do that, right? And I think I
mhm,
really fundamentally believe that 99.999% of doctors and people in general are good people who are trying to do good things. They're trying to take care of their family and they're trying to help the world. I think that, knowing that, I think most people come into work to help people and they try to help people the way that they know how. I think that when
mhm,
you are trying to help a patient, something I was thinking about this yesterday, you always are listening to their problem with this kind of extra lens over it of what is the diagnosis and how do I fix that? Right? Because they're coming to you with some sort of problem. And so yesterday I was sort of struck by this. I was talking to a long-term patient of mine who I'm extremely close with, has a really complicated background, but has declined to get any cancer treatment. And there's a lot of reasons why. She's extremely young. And she told me back in the winter that she was moving and that at that time, her reason she was declining is because she was moving and she had to get things sorted. And I know she has this fiance, and I asked her, well, can't he help you? And he should be packing. And she made some sort of joke about, men and packing and sort of he can't really deal with this.
mhm.
And I was like, okay, it's now been 4 months. And I said, whatever happened with moving? And she was like, well, I'm still moving. And I heard that really differently yesterday because I spent last week reading a book for our book club called There Is No Place for Us, which is about
Mhm,
actually, it's about Atlanta. It's an ethnography about Atlanta, and about this concept of, true homelessness versus people who are practically homeless, but are maybe living in extended stay motels or double or tripling up in somebody else's apartment. And so it follows these stories of these families. And it clued me in for the first time that when she had told me she was moving back in September, I heard that and assumed with the lens that I know about moving, that she was moving the way I've moved, not that she might be consistently moving.
mhm,
So this time I said, "Hey, um,
mhm,
you're still moving. Are you living in a motel?" And she was like, "Yeah, I've been living in an extended stay motel for 4 months, moving motel to motel. My car got
mhm,
repossessed." Starts telling me the story, and it's, like, exactly a story from this book. Like, it could be Pete and repeat of one of the characters in the book. And no wonder this woman hasn't wanted to engage in talking about her cancer because she's moving to a different motel every 2 weeks and carrying it with armloads and
mhm,
laundry baskets of her stuff. No wonder she's coming to the hospital
mhm,
4 times a month. Like, no wonder. And I think it just was a
mhm, mhm,
reminder to me that when people have problems and they voice their problems to you, it's so easy for us to hear them with the lens of what we think is right or what would be right in our life. I can't tell you how many times I've had teams
mhm.
call me to say,
Yeah.
"Why won't this guy move in with his daughter?" Like, just because you would let your dad move in with you doesn't mean that this guy and his daughter have a good relationship. He might rather be homeless than live with
Mhm,
his daughter.
mhm. That's the skill of listening, listening below the words, underneath the words. What people say and what they mean by what they say are two different things. The language of listening can be something that all of us need to get better at. What I remember of you is that you're really good at it, and you're really good at listening through the lens of your expertise as a physician, but also as a compassionate person, as a faithful person, and a person that somehow sees the absolute best in people all the time. And your emotional intelligence always somehow gathers up more intense feeling for the person who you are faced with, whether it's in the context of medicine or not. So, where did you get that? There's something there that you've somehow been able to train yourself into going deeper.
That's a really beautiful compliment. Thank you.
Mm. Not just a compliment, it's an observation that, you either see it or you don't see it. It's that cut and dry. It's either there or it's not there. Somebody told me once, "People don't change." So when you were an undergrad or when you were some green kid running around the block thinking, "I can do this, I can do that." Now you're a physician, you come with that same enthusiasm for life, but with a real depth of feeling for the people around you. And when I saw that palliative care, I figured, yeah, she's making that from womb to tomb idea of caring for people. It's not just the ones you can fix; it's the ones you can be with. Mm?
100%. 100%.
Where does that come from? How did you develop that sense of empathy and care, listening?
I don't think anyone in my entire life would have called me a good listener growing up. I think I was a good talker. I was
Mm.
extremely chatty. Like, I was always getting check minuses on my little Catholic school report cards for, like, raising my hand talking without raising my hand, you know? I think that still is a problem, and, like, I try. I
Right.
try to remember to raise my hand.
Mhm.
So I think part of why I say that is that if you had told me in medical school that in order to be good at palliative care or in order to do the kind of medicine I wanted to do, you needed to be a good listener, I would have immediately said that I must not be qualified because I
Mm,
don't think I'm necessarily a good listener. My mom used to say when I was little that she had the kind of face people told stuff to. Like she would
mhm.
call me, and maybe this is a small town thing, but she'd call me leaving the grocery store and be like, Sarah at the deli's granddaughter was just taken away by defects. And I'd be like, "Why Sarah at the deli tell you that?" Or she'd be like, "Mary at checkout, her ovarian cancer is doing better." I'm like, "I don't know
Mm,
why you know that." And some of that I think is a small town thing, but some of it is also, like, these aren't people my mother knew. Like, they weren't social connections of hers. But I
mhm,
think with a person who shows up and engages and, like, demonstrates that you want to be in relationship with people, I do think people know that. Another thing that comes to mind when I was in college, and a very dear friend of mine who was Muslim named Noor, we co-led a Quran Bible study, that met
mhm,
every Saturday for 2 hours for, like, 3.5 years, and it was one of the joys of my life. And we would get in the room, and it'd be a bunch of students from the Muslim Students Association and the, like, whatever Christian fellowship thing I was in, and we would all get together and I had this huge arm bag of, like, or this reusable grocery bag of, like, free Qurans and Bibles that I'd gotten when people were handing out tracts. Like, I'd be like,
mhm,
"I don't have a Bible," and they'd give them to me, so I'd put them in this bag. And I would come and we'd lay them all out. And, over time, I learned a lot of things about Muslim culture, like being really intentional to make sure that the Quran was stacked on top of a Bible or was sitting on top of a ottoman so that it wasn't lower than the Bible because that was a big deal. And I remember at one point someone saying to me, "You know what? I'm gonna forget how they phrased it, but it was something to the effect of, "Something I love about you is that you might be an idiot, but I know you love me." And I think about that a lot. I wanna be a person where I'm gonna make a lot of mistakes in my clinical care. I mean, I make a lot of mistakes in my personal life, make a lot of mistakes in my parenting. But I really hope that the fundamental thing anyone takes away from time with me is that they know that I love them and that I care about them. And I think, something I love about outpatient medicine is the ability to build longitudinal relationships. I think you do it faster in palliative care because people know their time is short.
Mhm.
And you have this ability to have people that like really know you love them, and
Mhm.
that is so precious to me. I I'm, like, surrounded by random things in my office that, like, a patient gave me because he went on vacation, and
Mhm.
I, like, got him to be able to go on vacation before he died, you know? And that's
Mhm.
so
Mhm.
meaningful.
Mhm. Yeah. Well, that's my experience. I can sum it up in saying that you really see people. You see people, and I don't mean something that you do with your eyes. I think it's something that you do with your heart. Let me say this one other thing, from what you just said, Quran and Bible study. You tell me what made that work?
I mean, it was a funny season of my life. I studied abroad in Jordan. I had all these Muslim friends, and we were going to a church that had a lot of Muslim members, and sort of like thinking through this question of identity and faith, and how much of our identity in these titles of being Christian or Muslim or Jewish or whatever is like a cultural identity and not a faith. And so, what
Mhm.
does it look like to say, I am a person who believes in Jesus and the sovereignty of Jesus as the Son of God. And like, can that coexist in a different identity? Like, is there any identity that is excluding of that idea? That was really meaningful to me. It was great learning for me. It also just taught me a level of cultural fluency in so many things about Islam. Like I went to so many iftars and I cooked so many, so many iftars, and that was just such a special thing for me to feel like I went into the world and I like had a language around how to talk about Ramadan, how to talk about Eid, how to, think about Islam and maybe like how Islam might be relevant to somebody's personal or healthcare life.
Mm.
I really loved it.
Yeah, that sounds like you. Sounds like the thing that, I drew out of that encounter between Bible and Quran is friendship, that somehow that is not possible for you to be open to seeing, the movements and the qualities and values of Jesus in somebody else's faith. And sometimes it takes a little glimpse into, seeing the other person, becoming friends with the other person in order to be open to what you can learn from the other person, and most importantly, about yourself. Yeah. You know something? I think that the fact that you're a physician and you're a teacher, so you're teaching young, people the art and the vocation of medicine, you have something particular that you're meant to do with your message as Dr. Emily Pinto Taylor. What is your message that you try to get across to your students, possibly as well as your patients? But this is something that's integral to who you are in terms of values. I, I sort of see it, but I have a little bias, so I'll better let you jump into that one. What's kind of everybody's got one message in this life. Some people are lucky; they get two or three, but most of us only get one. What's yours?
Yeah, that's such a good question. What's coming to mind, and I may not want to be held to this, I might have to revisit this at the end. We'll see if I come up with another one. What's coming to mind for me is the idea that everyone is doing the absolute best that they can today. I think about like the values with my kids. We talk a lot about how our family value is that we always forgive each other. That we are a family that makes mistakes and that we forgive each other no matter what.
Mhm.
That with learners that we engage in situations that are really complicated and often really stressful, and often a lot of people have a lot of discord with everybody else.
Mhm.
But sometimes people need to take the time they need until they're ready to get to a place where they can move forward. And like everybody is at the best place that they can be today. And sometimes you can help move them forward today, and sometimes you can't. They're out there doing their best just to be here. I really try to have a
Mhm.
lot of
Mhm.
humility about what our grady patients navigate before they get to the office. And I think, like, I mean, a silly but simple
Yeah.
story of that. when I was first a foster parent and my son was first placed with us. He was like 5 days old, and I was post call from an ICU 30-hour shift, and I came home, it's like noon, and he had his first newborn doctor's appointment at 2 o'clock. And we had one car, and my husband was at work. So I was like, "Okay, I'm gonna walk us to the appointment, but I wanna take a nap because I have time." Like, the appointment's not for an hour, and it's probably a 20-minute walk. I'm gonna take a nap. The baby's napping, he's little. I'm gonna take a nap. I'll wake up, I'll pack the bag, and I'll go to the appointment. I take a nap, I wake up, it is 2:15. The appointment I'm already 15 minutes late for the appointment, and I don't have a car. So I wake up this baby who's now crying, and I'm, like, feeding the baby and throwing all the stuff in a bag and sticking the baby in a stroller and, like, sprinting across town because it's a good 20-minute walk. And it's at the hospital where I work. I get to the clinic. I wait in the line of the resident clinic. I wait in the line. I get up to the front of the line. The lady says, "Who are you checking in?" And I say, "I'm here to see so and so, but I know I'm an hour late, but can you call him and see if he'll see me? Because he knows me. He's one of my co-residents." And she says, "Well, what's the name of the child?" And I look down and I realize my son was discharged under a pseudonym, which is something that they do for kids who are in foster care sometimes. So he has a pseudonym, and I don't know what it is,
Mm.
and I don't know his date of birth, and I don't have his medical insurance card. And so
Wow.
I was like, all they gave me was the appointment time. It's at 2 o'clock. Can you just see who's scheduled at 2 o'clock? And I will never forget that, like, coming to this appointment and being like, "I'm an hour late. I don't know his name, and I don't know how I'm paying for this appointment, but can you see me anyway?" And they
Mm.
saw me anyway, and it was great. And, it was just a reminder to me in that simple thing, like, I have been so blessed to not have to worry about how I'm gonna get to a doctor's appointment or whether they'll see me when I get there. And I don't know the complexity of what people go through outside my office, but I want there to be room for that. I wanna have space and give grace to the idea that it's hard to get here, and we're all doing the best we can to be here today.
Mhm. Yeah, I like that summary of, we're all trying to do the best we can. Is it good enough? And what you just said, because you're of a certain caliber of person in living a caliber of life, your good enough is good enough because you still could get it done. We're living in a time where you wonder if the people who have those tickets into making it happen, that ability to skirt the rules, not that I'm not going into you were skirting rules, you were just trying to survive and get the kiddo into the doctor. But there's a way when you go deeper into this idea of we're doing the best we can today, I can appreciate. However, when it comes to for our society, for our world, for the the message we want to send to the people who are at the bottom of that access availability, is the best we can good enough? I think it's just an ideal time to kind of ponder that idea, to be curious about the best that we can, because there's so many things that we're missing in the process of getting to where we're going. Even something as simple as meditating on the moment. What does that moment teach me? What is this moment teaching me?
I'm terrible at that. I
No
No,
judgment.
no. I think that's an interesting question. I wanna think about this because I've never been asked that question before. But what's coming to mind for me is immediately a kind of push on the best. So, maybe the best is good enough, and therefore we aren't giving our best if it isn't good enough, you know?
Mm.
Like, I
Mhm.
think something I wonder about, I see this all the time in the hospital, is that I think to be successful in a safety net setting, you have to be willing to do more than your job. It
Oh.
is like every day, I am doing a billion things that are not my job. I, like, just found a man a pair of pants, which is why I was late to this conversation,
Mhm.
right? Like, it is not my job to find this man a pair of pants, but he needs a pair of pants, and the social worker is busy, and I know where the pants are, and I went to the closet, and I found him a pair of pants. Is his whole situation better now that he has a pair of pants? No. Like, he's getting discharged, and it's freezing today, and he's going to a warming shelter, and that stinks. And, like, that's not right, right? Like, that is not the world made right.
Mhm.
But I think that if we're willing to do the most that we can, I think I have to believe that it's enough, otherwise I would burn out and feel like I'm dying. Yesterday, this woman with the extended stay motel, I have been on so many phone calls and chats and email threads about this lady because I was like, I love her and
Mhm,
she needs to be connected with help. Like she's stuck.
mhm,
And, I talked to somebody in the mayor's office yesterday. Today I'm in a chat thread with like 6 different people at Grady trying to figure out like what are the resources through the VP of health services and delivery to the community. Like how could we try to help this lady get into one of these motel to home programs?
mhm,
These services exist. It's just a matter of other people that I need to help me realizing they have to work a little harder and do something that's not really their job because this isn't really my job either. But actually it is because overall she's suffering, and my job is to try to help alleviate suffering.
mhm, mhm, mhm.
And I
Yeah,
think I like that that's my job description. I
mhm,
think a lot of, like, cardiologists might not say their job is to alleviate suffering, but
mhm.
actually, it very much is my job. And so if the suffering is from lack of housing, like, that's still a thing that I wanna help with.
Yeah. Well, you nail on the head there. I'm right with you, because in the religious world where I come from, in terms of serving, that's called the magis. You're seeing somebody, and you're not just seeing the little piece that you have to see. You're opening your eyes, the eyes of your heart to be able to see, here's a need that I can do one simple thing. And it may not be simple in the whole context of things because I'm sure you had other patients, you had other responsibilities, you had all these things. But when you look at it, if all of us took the time to do more than was required, which is the magis, which is the going one step further to help a person to feel human, to feel seen, to feel cared for. I can get really on a soapbox about this, but we won't go there. We'll just leave it at that is, um, you're always called in some way to be willing to do more than the best that you can because that's what we're called to, especially when it comes to our relationships. Our relationships, your relationship with your parents, with your patients, um, connects to your own family, connects to your own life, connects to your own call. And so I think that you're doing the best you can and more than you think.
Yeah, I hope so. I think it's interesting having kids the age of mine who are sort of just way far, my 3-year-old is way far from understanding anything about what I do, and then the 7 and 8-year-old are, like, just kind of on the cusp, I think, of understanding, like, I am a person outside of my identity to them.
Mhm,
I think you really have to be kind of a preteen to get that. It's interesting, I think one of the, like, deepest desires of my heart is that, my kids like who I am and that they are, like, proud of who I am and what I do is a part of that. What my husband and I do is so central to, like, our family values. He and I have talked about that a lot. Like, working in service industries for people that are in need is so central to our family values that, like, someday if one of my kids decides they wanna be an investment banker, which would be a perfectly lovely job, I think it would be, like, actually an adjustment for me to kind of figure out, like, how I feel about that
mhm,
in a way that I, like, I don't mean that to come across as, like, that's not a valuable job. I have a brother who does that, and he's so wonderful at it. But I don't know, I hope that all these things that I have to do to have a job and to be away from them when I am or think about work on the weekends or whatever, I hope that the way that I talk about work and the world teaches them something important. I think so much less of parenting is about, like, directly teaching than you think it would be.
No, you're right. You're right. And from my experience of you, I think that you're really not necessarily naming you don't have a job. You have a vocation. And that's in my mind much bigger than a job
It's also
because
such
you've
a
been
privilege to have a vocation, though. Like, think
yes.
about how many people do not have the choice to have a vocation,
Mhm.
you know? Like, they do what makes money.
Right. And to do what makes money is a job, right? Anyway, just to go back to that whole idea of what you do, I think that there's so many ways where perhaps you don't name it, perhaps it's not right out there with the sign on your office door saying that you are Dr. Emily Pinto and your vocation is medicine, and it goes way beyond doing doctoring work. There's the way you live your life, and the way that you love your children and give them your confidence. That's a vocation, without doubt. But we still only have one message in this life, and we have to figure that out before we finish up in this life.
Do you think it's a different message to your personal world and your professional world, or do you think it's just one?
Oh, no, I think it's one message that we have, and I don't have all the wisdom in this. I really don't, because I've gained so much from the people that I've worked with and learned from, and the reading that I've done, and the people who have mentored me. There is generally, as human beings, it may have a different name for each one of us, but we all have that one thing that we've been put on this earth to do. And we're in the practice of figuring that out each day that we live.
Yeah, I was just thinking about like the things that I'm good at and whether I could say that it's like a universal thing that ties together those things.
Yes.
Um I think one of the things that's been rattling around in my head as we've been talking is that if I could pick a thing that ties together what I'm good at personally and professionally, I think I want it to be building relationships. I think that's the thing that I'm good at. I often tell people that it's hard in some ways it's hard for me to teach some of the communication skills things that I like because I so heavily rely on my relational equity. I know you and I care about you and I care about you and that gives me the permission to say hard things
Mhm.
and things you may not want to hear. Um, and it's a little bit hard then to teach a learner who doesn't know how to communicate that they care about somebody,
Mhm.
say the same hard things because it just doesn't come out the same way. But one of the things that's been rattling around in my head as we've been talking too is that, when you're good at building relationships with people, sometimes what gets revealed is stuff that you didn't know that you didn't want to know. I mean, I can't tell you how many times, actually I could probably count how many
Mhm.
times I've had a learner tell me that they were suicidal, like actively suicidal today,
Mm.
or call me because they were going to get divorced. Or I had a patient once who showed up to clinic and said, um, they had called me the day before. They had left a message with my CMA. It was late in the day. I didn't call them back. They came the next day and it was someone I really liked. And I was like, how are you doing? Turns out they had taken a knife into the shower the day before to kill themselves. And they
Mhm.
did the shower so their wife wouldn't have to clean it up. And then while they were in there, their phone buzzed with the reminder that they had an appointment tomorrow with me at Grady. And they thought, well, I guess I'll wait until tomorrow so I can say goodbye in person. And I'm not
Oh.
sure that the person would have told me had I not been the sort of person that they felt like they could trust enough to say that, you know?
Mhm.
And I mean, I think it sort of reminds me of my mother and like having a face people say stuff to.
Mhm.
I like people tell me about their substance use. People personally tell me about their substance use. I had someone
Mhm.
call me who I was close with personally to tell me that her husband had dragged her down the hall by her hair and had been hitting her for years and she'd never told anyone. It feels like a privilege to be told these hard things, recognizing that it is built out of a desire to be in relationship. An authentic relationship is often really messy.
Yes. And perhaps this is why this narrative medicine is so important to you, to have the face of someone that people can tell their story, their authentic stories to, and be able to have a way to articulate what that meaning is for them and for yourself. That must have something to do with why you're attracted to that from the beginning of life right through until the end of life. It sounds like you're there. You want to be the face of that compassion for people.
Yeah, I do.
Well, look, I want to ask you if we can kind of wind down our back and forth by just maybe if you could take a second to put some words to what's love got to do with all of this? Everything that you're doing from family to patient to teaching to being Emily with her one message. What's love got to do with it?
I mean, I feel like love is all of it.
Yeah.
Like I actually feel like love is the thing. Love is the thing that I want people to know about me, like love is the thing that I want my kids to know about me. And like the things that I fuss with them about are out of love for how I want the world to see them. I feel like love is the whole thing. And
Mm-hmm.
I also think like something I find really special about the end of life is that as people are dying, their worldview narrows so much. They don't keep the TV on anymore. They don't, like, nobody cares about any of these things. Like,
Mm-hmm.
what they actually care about is the people that they love and the people that love them. And that's it. And I think that feels so meaningful to me that at the end of the day, that is all that it is, even when you can't even express it anymore.
Mm-hmm.
It's just about feeling love and feeling the love of other people.
Yeah. Well, I say amen to that.
That- I think that's the lived out love of God. Like, that's the hands and feet.
Mm-hmm. Well, thank you so much for having this little bit of time to, share our going back and forth with our thoughts and this whole idea of being in medicine, caring for people, living your life, your best life right now, to send that message of love to your kids, to your husband, to a community of listeners here. And I thank you for that.
Thank you for bringing this up and inviting me and making space for me to be with you. It's so special. It feels so weighty and important, and I'm really grateful for it. Can I ask one other question?
Sure.
What do you think is my one message?
Oh, that's the discovery of our lives. That's a lifelong journey
Mhm.
that we somehow figure out what we are meant to be for the world. And when you figure that out, then you're done. Now, that's all in relationships, by the way. That's the way I think about it. We all have a message.
I
If
love
you've
that.
ever preached or if you've ever taught or if you've ever tried to sit and listen with loving ears with a patient, basically in the back of your mind, that's you there. So I
I
really
love that.
can't tell you what your one message is, but I kind of know what mine is. I'm still discovering it at my age.
I want to believe life is a process of constant rediscovery. So I'm glad
Mm,
that you're still discovering it.
yep, still.
This was such a delight, my friend. Thank you.
Thank you. And now for the wrap up. You have just had a human experience from a spiritual being. We have so much to learn. So go forth to love and speak the truth. Ad majorem Dei gloriam. A couple of announcements. Don't forget to rate and follow us on Apple Podcast or Spotify. We are on Facebook at Love Speak Truth and visit our website at www.lovespeaktruth.org. For a few credits, when all is said and done, I give thanks and credit for sponsors, producers, and contributors who made this podcast possible. Mega shout out to IBVM Region Leadership, Megan Butel, Jennifer Schmitz, Laurenti Wright for the keyboard music, the late Sister Maria Beer IBVM for her composition of the music Women Bearing Witness. It takes a village, folks. Thanks for listening to Love Speak Truth.